Sri Lanka, an inspiring COVID-19 success story. This is the story of an island nation that is well known for its golden beaches, world-renowned Ceylon tea, mesmerizing waterfalls, and home to the first female Prime Minister of the world. What defines its people is their amazing resilience to endure great calamities and defy all odds to rise again to glory. A country that was once battered by a 30-year-old civil war and devastated by a tsunami could not hold down its potential to become the best tourist destination for 2020 when the deadly coronavirus unleashed havoc at the prime of its potential. Now that we have heard all the things that Sri Lanka is famous for, it's time to understand the secret recipe behind the COVID success story of this island nation. Sri Lanka has had only 91 cases per 1 million population, 11 COVID-19 deaths, and absolutely no cases in the community for over 2 months, since 30th April 2020. It went from this to this, and came back to this. All of this took place while maintaining one of the most impressive disease mitigation records globally. This is the story of how we did it, with a GDP for health of only 3.81% and a population of 21 million. So, how was Sri Lanka so successful in its containment of the pandemic? Let's look at the contributing players and factors in this remarkable story. The first report of what we now know as COVID-19 came to the world's attention on December 31st, 2019. Sri Lanka was very quick to act on this information and subsequent circulating rumors. The Ministry of Health, with relevant stakeholders, immediately identified the need for risk communication, rumor monitoring and mitigation, and readiness for the imminent epidemic. The Influenza Steering Committee, where global health issues are discussed, organized by the Epidemiology Unit of the Health Ministry, along with the Health Promotion Bureau, discussed the ongoing epidemic and preparedness plan on the 9th of January 2020. A presidential task force was speedily appointed during the last week of January 2020, with multi-sectorial involvement and stakeholders identified at all levels. A national COVID center was established and streamlined activities to 10 committees. The Director General of WHO declared the outbreak of COVID-19 a public health emergency and subsequently a pandemic in early March. By then, Sri Lanka was on full alert with counteractive measures already in place. By the time the first local patient was found positive on 9th March 2020, regular press releases from the Ministry of Health and identified key spokespersons began very early. This built trust of the general public on the government information sources and communicated the real situation. Early emergency preparedness with strong political commitment and support by health, Triforces and the media went a long way in Sri Lanka's favor in winning the battle against COVID-19. Mechanism to safeguard all ports of entry against the import of COVID-19 were in place. The quarantine unit of the Ministry of Health had a vital role in this. The information was disseminated in all 3 local languages and in Chinese, as the epicenter of the disease was China, with many Chinese arriving in Sri Lanka for tourism and employment. A surveillance system and contact tracing mechanism was established, linking ports of entries, the Epidemiology Unit of the Ministry of Health, and provincial health authorities. grassroots level public health staff worked around the clock with quarantine and contact tracing. Health services were easily accessible and just a phone call away from medical officers of health teams who delivered very efficient, personalized service. Quarantine and contact tracing was so successful that there were ultimately only 6 main clusters in Sri Lanka. The Disaster Management Center also had a vital role in COVID-19 management. A very strong quarantine and contact tracing mechanism was a prime factor in our success story. Travelers arriving from high-risk countries were quarantined on arrival in special centers for 2 weeks, while home quarantine was allowed for other arrivals. But as the epidemic reached pandemic heights, with borders closing globally, all arrivals were immediately taken to special quarantine centers. Services were provided completely free of charge to those in quarantine centers, with gratifying hospitality and humanity shown. The numbers of quarantine centers and persons quarantined increased, with momentum being kept up by health staff and Triforces. The infectious disease hospital was identified from the onset as a key site for COVID-19 management, with a staff very competent in case management and infection testing. Hospital staff also communicated over media the necessity of the general public staying at home. 16 other hospitals were also initially identified for COVID management and strengthened rapidly with speedy expansion of the hospital network. Hospitals from each district were in early readiness to prevent overwhelming of the health system, even before the first local COVID case was reported in Sri Lanka. Triage for fever patients was done at hospitals in all districts. Sri Lanka was one of the first few countries in the Asian region to detect COVID infection through PCR testing. The capacity was established within the country at the Medical Research Institution and greatly scaled up to provincial level subsequently. Free ambulance services were available throughout the country for anyone reporting COVID-19 related symptoms. Massive media support was vital to information flow, destigmatization and myth-busting, with time worth millions of rupees for advertisements to control and prevent COVID-19 donated generously. Even songs were written, which were very popular and effective. COVID-19 prevention behaviors became widespread, with workplaces and the general public being immensely supportive. Positive health behaviors were greatly advocated through mass media, with tremendous impact. Physical distancing became the norm, with even major celebrations being confined to households. Further aided adoption of good practices with an evidence base. Support and aid were obtained from the World Health Organization, UNICEF, the Government of Australia, the United States Department of Defense, the Embassy of the Republic of Korea in Sri Lanka, etc. The Ministry of Foreign Relations got on board with the other sectors at the initial stage in self-facing this multifaceted challenge. The Foreign Ministry took the direct responsibility to look after the welfare of the overseas Sri Lankans and establish links with the relevant foreign embassies. The ministry has been looking into the needs of the diplomatic and expatriate community residing in and visiting Sri Lanka. Schools island-wide were closed within a day of the first local COVID-19 patient being identified. This greatly reduced the risk of community transmission and possibly prevented the transmission to the elderly, as many Sri Lankan families have grandparents living together with parents and children in the same household. Work from home was encouraged across all sectors, with flexible working hours, rosters, and minimum staff. The government rapidly mandated work from home. Mobile door-to-door delivery of essential services such as food, medicine, and even banking commenced. Postal services were utilized for door-to-door delivery of prescription medicine from government hospitals and online orders from pharmacies. Prescriptions and clinic books were used as curfew passes for access to essential health services and medicines. Pensions were delivered to the elderly, or they were permitted to visit banks on designated days to obtain pensions. Supermarket and grocery chains immediately came on board with online and door-to-door services. Agricultural work was allowed during lockdown, and rice mill owners' work declared an essential service. Home gardening and cultivation projects were encouraged by the government to help alleviate future possible food shortages and insecurities. Daily wage earners and other vulnerable households were provided with social welfare payments to tide over the crisis. Many organizations and volunteers got together to give food relief and essential item packages to vulnerable families. Support of divisional secretaries was immensely valuable in the process. Education got on board very quickly, with online lessons being conducted by universities and a majority of schools. Provision of PPE and other protective measures which were dire needs was supported innovatively by the general public. The most powerful force of all the people of Sri Lanka was the biggest asset that changed the tide on this pandemic. There are vulnerable people with limited reserves for survival, but they never fought over the supply of essential commodities. There is no better testimony of the hospitality of the islanders than the thank you notes and videos of the tourists who were stranded in Sri Lanka due to the rapid closure of borders in their home countries. They showed the world that humanity will prevail even in the absence of financial incentives, and sets an example of rising above materialistic gain in a time of global crisis. So, we may say that our remarkable journey to success was founded on free health, free education, high literacy, a strong public health system, a supportive government, and of course, our renowned hospitality.